Hi everyone, this is Dr. Sam and I'm on another morning walk. I'm actually on the Windsor Trail, which is a trail that runs through the Sangre de Cristo Mountains in northern New Mexico. And it's one of my favorite hikes, especially in the morning. There are not too many people on the trail. Well, I wanted to talk to you this morning about some emails that I've been getting from people where they're feeling really discouraged when they go to the eye doctor and their eyes seem to be getting worse and worse every year. So the first thing I want to say is that to be truly holistic, I believe that I have to embrace both the allopathic principles of eye care along with the alternative and complementary methods. And so in that scenario, sometimes the techniques or the procedures that allopathic eye doctors are doing actually can be helpful. And in saying this, I have developed lots of different methods to help people improve their vision as they get older. And one of the myths that I have definitely challenged is that our eyes actually can improve as we age. So the first distinction I want to make here is that there's a difference between sight and vision. So sight is seeing a 1/3 inch letter at 20 feet, and that's called eyesight, and that's from the 2020 reading of the acuity chart. We call the Snellen acuity chart. That's sight, it's not vision. Vision is how the eyes and the brain and the body work together. It's a dynamic skill set. And eyesight is only one aspect of vision. Now, in my practice, I did a research study once, and I found that 95% of all of the people that were coming in for vision exams were overcorrected. They were wearing a lens prescription that was too strong for them. And when you wear a really strong prescription, it actually tightens your eyes up and it compresses the tissue in the eyes. And it's a major reason why the eyes get worse, because you're already in a stressful situation and you wear this prescription, whether it's contacts or glasses, and your eyes are only going to get worse because it's such a tight-fitting lens. And when you base the prescription on the 2020 eye chart, I can tell you that it's going to weaken your vision. There's no question about that. And we want to blame faulty vision on a deteriorating eyeball, but it's not really the eyeball's fault. What's happening is that we develop prescriptions based on how we interact with our environment. And yes, there's some people that say, well, it's just genetics, and I would disagree with that. I think that genetics is a piece of it, but what really is going on is that our eyeglass or contact lens prescription is a computer readout of the adaptations we've made to our environment due to stress, and that we get a prescription, based on whatever's going on in our, mind, brain, eye situation, and we get that prescription and we start wearing it, and it's only treating a symptom. So if we take, for example, myopia, myopia is about having difficulty seeing far away. But what's really going on in myopia is that on a spatial level, we pull the world in as a way to protect ourselves. Just as in hyperopia, which is farsightedness, that has to do with pushing the world away. And in either case, there's an adaptation going on that we're not able to comprehend or understand what's going on in front of us. So we either pull the world in or push it out as a way to try to figure out what's going on. Now, with hyperopia, when we turn 40 and our arms aren't long enough, that's called presbyopia, and we start wearing magnifying lenses. And you'll notice that if you start down that road, your eyes are going to get continually worse and worse and worse, because a magnifying lens does nothing more but disconnect you from your eye muscles. So we've addressed myopia, hyperopia, presbyopia. The fourth condition in refraction is called astigmatism. And that has to do with a twist in the eye where there's an irregular blur. And so what happens is there's a twist in the eye that creates this blur, and you get a prescription for astigmatism that supposedly corrects it. Well, no prescription actually corrects you. It just meets you or matches the adaptation that you're bringing to the doctor. So, what can you do here to begin to reduce the dependency of your prescriptions? Well, number one, my recommendation would be when you do get your 20/20 prescription, ask your doctor for a reduced prescription. I would say a 20/40 prescription, and start to wear that prescription in non-demanding, non-threatening situations. And you're going to notice when you start wearing it, your eyes are going to feel relaxed. Now, it's really important that you wear these lenses when the demand is very, very low, because you don't want to create more stress in your vision and try to drive with them or do something where there's a high demand. So if you start wearing this prescription in non-demanding situations, you're going to find within a month or two that you're actually going to see much clearer out of it. And when you put on your regular habitual glasses or contacts, they're going to feel too strong or too tight. That's when you know you've made some progress. Now, another idea that you could ask your doctor for would be that, let's say you have astigmatism, to get a prescription that doesn't have the astigmatism in it and start wearing that in non-demanding and non-threatening situations. Because you see, any prescription that's in the eyeball is also in the body, either through your posture, through your movement, through your emotional awareness. And astigmatism is a twist. There's usually a twist in the body as well as the eyes. And when I started to study craniosacral therapy, and I would measure somebody's eyesight at the beginning of the exam, and then I would do an hour of craniosacral therapy and unwind them, then I would remeasure them, and I would find that the astigmatism would be reduced, and in some cases would be completely go away. And that's when I would prescribe the prescription. So it would be really interesting to get a prescription without the astigmatism in it. Again, start wearing it in non-demanding, non-threatening situations. Now, in farsightedness, this is a very different condition, because the lenses that you're wearing, they're called plus lenses or magnification lenses. They actually weaken your eye muscles and you lose the responsiveness of being able to focus. That's why you need stronger and stronger magnification. One of the techniques that you can use is getting a pair of pinhole glasses. These are glasses with tiny holes in them, and start wearing them instead of wearing your reading glasses. You're going to notice immediately you're going to see the print really clearly, but there's no magnification, so you're not getting the side effects of what the prescription does to you. And you can start wearing them, say 5 or 10 minutes a few times a day, and then get a pair of reading glasses that is less than what your normal reading is, and in good light, start reading with it. There are also some, eye exercises that relax your eyes, called palming and sunning and long swings. These are exercises that are on my website, and you can get those for free. But I'm here to say that even though when you get older, chronologically age, your eyes don't have to get worse. They don't have to deteriorate. In my own case, I was very nearsighted when I was about 8 years old, and in my late 20s, I met a holistic eye doctor, and I went through his vision therapy program, and I completely reversed my need for nearsighted glasses, and I don't use lenses today. I see 20/20 at distance and near. So I'm a walking example. If I can do it, you can do it. So thanks for joining me on this walk. It's always a pleasure, and until next time, I'll see you on the trail. Take care.